Now, this question is in two parts. First, you need to recognize what disorder the patient is having, and then you need to tell what treatment could be there for this disorder, and then you need to see that what is the side effect of the treatment. All right. Now, this person has come because his friend died of bladder cancer. Now, he is worried that he could have bladder cancer, but he is not able to stop smoking. Okay, this is one part. Now, you can also see that this patient is having certain depressive symptoms, that he has been feeling down, he's not been eating, he's not been sleeping, he's having problem paying some of his bills, he's moving a lot slower. Moving slower is called, what is moving slower in your SIG-E CAPS mnemonic for depression? What is that? What is moving slower? You have your SIG-E CAPS mnemonic, all right? I'll just revise the SIG-E CAPS mnemonic for the rest of you till then. S is for lack of sleep. I is for lack of interest. G is guilt. E is a lack of energy. C is a lack of concentration. A is appetite problems. P is psychomotor retardation, which is what this patient is having. All right, moving slowly. And S is suicidality. For all of those who all are new, SIG-E CAPS is the mnemonic that we use. And if any more than 5 of these are present for more than 2 weeks, and at least one of them is a depressed mood, then you say the patient is depressed. It's given in first aid. It's something you need to mug up so that every time this is present, you can diagnose the patient as depression. All right. So now this patient has depression, and he's also trying to stop smoking. All right. When somebody has depression and they are trying to stop smoking, which is the go-to antidepressant drug? Propion is the go-to drug if you are also depressed and you also want to quit smoking. Spiron is an anti-anxiety drug that has nothing to do with this. Bupropion is the antidepressant drug which also helps you quit smoking. I get that the names are similar, but they are very different drugs. All right. So bupropion helps in depression and to quit smoking. So this patient has both. So you want to give bupropion, and now the next part of the question is that what is the side effect of bupropion? And decreased seizure threshold is the main side effect of bupropion. That is why we avoid it in. Who do we avoid bupropion in? Because of the side effect of decreased seizure threshold. Will avoid it in bulimics or anybody else with a metabolic derangement, all right? Because when your electrolytes are all over the place, especially in bulimia, is this disorder where you eat and then you vomit, right? So when you're going to vomit so much, your electrolytes are all going to be all over the place in the body, and then you're obviously going to have a lower threshold for going to procedure. Other places are when you're in like benzodiazepine withdrawal, alcohol withdrawal. At those times also your seizure threshold is low. So in these cases, you need to avoid bupropion. All right. Now our other options are restlessness. Okay. Restlessness at initiation or termination. Which drug does this? Which drug causes restlessness at initiation or termination? It's SSRIs. All right. SSRIs. This is quite typical. Okay. Like SSRIs are used for anxiety, but at the same time, at the beginning, when you just start your SSRIs, you can have a little bit of an increase in your anxiety. That's why you actually prefer starting them at a lower dose. And even when you stop them, you're going to have a little bit of an increase in your anxiety and restlessness. So SSRIs are known for doing this, okay? Just remember this, like SSRIs are used for anxiety, but at the beginning, they might increase your anxiety and restlessness a little. Worsening of uncontrolled hypertension. Which drug is going to cause worsening of uncontrolled hypertension? Venlafaxine, which is an SNRI, is notorious for causing an increase in blood pressure, which is why we try to avoid it. Good going, guys. What about sedation and weight gain? Which drug causes sedation and weight gain? And I want you all to name drugs other than the one which has been given in the MOOCs explanation as well, alright? Because I know you all gave this test recently. Mirtazapine, which is another antidepressant drug, which is used in anorexics because it helps in weight gain. All right, this is important. Mirtazapine is an antidepressant drug which helps in weight gain, and that is why it's used in anorexics. And then you have your atypical antipsychotics which cause weight gain, the most notorious of which is olanzapine. All right. Overdose can be treated with soda bicarb. Which drug is this? Whose overdose can be treated with soda bicarb? It's TCA. whose overdose can be treated with soda bicarb. Alright? So most of this was given the Mochi explanation. Now tell me which other drug tell me another drug whose overdose can be treated by soda bicarb, which is by alkalinizing the urine. Aspirin. Remember, aspirin causes toxicity with tinnitus, metabolic acidosis, respiratory alkalosis, and then you have to alkalinize the urine to treat that toxicity. Alright?
Thanks for watching. Please give a thumbs up and subscribe for more.